this is my final practical for athletic training 310, so I just have everything that I have written down here for what I have to do. I'm going to start off with palpations. So the first palpation I have is the acromion process. This is going to be on the superior side of the patient's shoulder. So the acromion process is right here. Next, I have the lateral epicondyle of the elbow. This is going to be when the patient's forearm is in supination. The lateral epicondyle is going to be palpable right here on the elbow. The lunate is going to be palpable in the patient's hand. This is one of the proximal carpal bones. It's going to be palpable right here. The medial border of the scapula is going to be right here. Just go ahead and relax. The scapula is here, and the medial border is palpable all through here. The first MCP joint is going to be right here. So the thumb is going to be the first finger, and then the metacarpal phalangeal joint is right here on that. The pronator teres, so the muscle belly for the pronator teres is going to be when the patient is in supination. It's going to be palpable from the lateral side to the medial side of the forearm. So all through here is where you can palpate the pronator teres muscle belly. And then for range of motion, I have shoulder flexion, so if you can go ahead and lay on your back. The goniometer for this, the stabilizing arm, is going to bisect the patient's spine. The fulcrum is going to go on the lateral side of the patient's shoulder, and the movement arm is going to go in line with the humerus. So I'm going to line up the goniometer, and then I'm going to ask the patient to bring their arm straight and directly up above their head. So go ahead. Keeping the goniometer in line and go as far as you can. The patient has 181 degrees of shoulder flexion. You can go and relax. This is about normal because 180 degrees of flexion is normal for shoulder range of motion. And then that was for active range of motion. For passive, I'm going to have the patient relax, and I'm going to take their arm in my hand and bring them into full shoulder flexion. And then for resistive range of motion, I'm going to apply a resistance force to their arm, and I'm going to ask them to bring their arm all the way up above their head like they did before. Go ahead. Go, 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 go. Go. Keep going. Good job. Relax. That was for resistive range of motion. And then for my manual muscle test, I have the adductor pollicis, and then the nerve for this is going to be the deep palmar branch. So can you go ahead and sit in the chair for this? And then the action is first CMC MCP joint adduction and first MCP joint flexion, and this also assists in opposition. And then the origin is the capitate base of the 2/3 metacarpal and palmar of the 3rd. And then the insertion for this is the ulnar surface of the base of the proximal phalanx of the thumb. So for the manual muscle test, you can point at me. For the manual muscle test, I'm going to have the patient's arm in pronation on the table. I'm just going to take your watch off. Can you take it off? I'm going to have their arm in, supination, and I'm going to have them go ahead and relax with your fingers against the table and bring your thumb straight up. And I'm going to apply, you can come like here, I'm going to apply a force at the MCP joint, the first MCP joint, and then I'm going to ask them to bring their thumb back down to the table. Go ahead. 1, 2, 3, 4, 5. Relax. The patient would receive a 5 out of 5 for their manual muscle test because they were able to hold the position, which would give them a 3, and then they gave adequate resistance with the manual muscle test with the resistance. Moving on to special test, I have the clunk test first, so can you go ahead and lay on your back? This is going to be testing for a Bankart lesion, and a positive test would be a clunk sensation or pain. So I'm going to first bring the patient's arm into 90 degrees of abduction. I'm going to rest their forearm in my forearm, and I'm going to grab their humerus here. I'm going to put a anterior resistance or anterior force on this, so bring them up, and then slowly bring them into more shoulder abduction here. And if they had a positive test, they would feel pain here, and I would also feel a clunk when I move the shoulder around in the socket. Go ahead and relax. That's testing for a Bankart lesion. And then you can sit up. The second special test I have is moving valgus stress test, and this is testing for the medial collateral ligaments of the elbow. So I'm going to bring the patient into 90 degrees of abduction, and then I'm going to bring them into elbow flexion. Go ahead, relax. Relax your hand. And then you can come on the other side. I'm going to apply a valgus force as I bring the patient into elbow extension. So applying a valgus force and rotating the shoulder into external rotation, and then extending the elbow here. And if the patient had pain with this, that would be a positive test, as well as excessive laxity with the valgus force. And then my last special test I had is Phalen's test. So this is testing for carpal tunnel syndrome. Go ahead and face me. This is going to be all the patient. So the patient is going to take their hands like this and put them together here. So your wrists are going to be touching all the way here with your fingers going all the way down. And I would have the patient hold this position for 1 minute. And if they got a tingling sensation in their thumb, so their first finger, second finger, third finger, or on the lateral side of their fourth finger, this would be a positive sign for carpal tunnel syndrome.